Assalamu alaikum. My name is Aisha Zahid and my topic name is Azithromycin. My roll number is BP1650050. Here I have taken Zithromax brand as a reference of azithromycin. Azithromycin basically used to prevent and treat serious type of infection, mycobacteria. It is a macrolide type antibiotic. It works by stopping the growth of bacteria. The indications of azithromycin includes the pharyngitis, community-acquired pneumonia, middle ear infection, acute bacterial sinusitis, uncomplicated skin structure. For different diseases, we have different doses of azithromycin. In community-acquired pneumonia, in adults, azithromycin is given 500 mg, which is at least given for 5 days in combination therapy. In infants, 1000 mg, which is followed by 500 mg. It is either given through IV route or as oral. In uncomplicated skin structure, the recommended dose is 500 mg, which is followed by 250 mg in adults. Okay, now in acute bacterial sinusitis, in adults 500 mg azithromycin is given for 3 days, and in infants 6 months and older 10 mg azithromycin is given for 3 days. And in pharyngitis or tonsillitis, adult dose is 500, which is followed by 250 mg. There are different adverse effects of azithromycin, which include diarrhea, nausea, abdominal pain, loose stool, cramping, vaginitis, indigestion, and other serious side effects may include high level of transaminase, high level of alkaline phosphate, and there also may be liver damage or irregular heart rhythm. The other alternative brand of azithromycin include Augmentin, amoxicillin, ciprofloxacin, clindamycin. The reasons of alternative brands of azithromycin may include either the patient is renally compromised, either patient is not well tolerant towards azithromycin, or he is showing resistance. And we have different drug-drug interaction of azithromycin. The drugs which show interaction with azithromycin are digoxin, phenytoin, and antacids. We have different other choices of azithromycin, which may include Azolib, Zitro, Azomax. Either we can give azithromycin as in tablet form, or as in suspension, or as IV route. Contraindication of azithromycin includes jaundice, hepatic necrosis, hepatic failure, abnormal liver function, which may lead to the death. The irrational use of azithromycin include pulmonary prophylaxis, such as cystic fibrosis or chronic obstructive pulmonary diseases. Before moving forward, we should know what is community-acquired pneumonia. Basically, it is the most common type of pneumonia and is the leading cause of illness and death worldwide. Its causes include bacteria, viruses, fungi, and parasites. Community-acquired pneumonia is diagnosed by assessing symptoms, performing a physical examination by X-ray or by sputum examination. Patient with community-acquired pneumonia sometimes require hospitalization and is treated primarily with antibiotics, antipyretics, and cough medicine. Most common causative agent is Streptococcus pneumoniae, which is responsible for almost 50% of cases. Other common causes are respiratory viruses like mainly influenza A and atypical bacteria and mycoplasma pneumoniae. My patient is male and 61-year-old. He is suffering from sweating, cough, shallow breathing, fever, weakness, and sore throat. His X-ray reveals a right basal pneumonia. The next day, his sputum yields growth of beta hemolytic streptococci group A. The chief complaint of my patient was community-acquired pneumonia. The symptoms occurred few weeks ago. His symptoms and characterization includes cough, shallow breathing, fever, chills, and sore throat. There was no radiation of pain and the temporal pattern due to growth of beta hemolytic streptococci group A, and the mortality rate of community-acquired pneumonia is around 5 to 30%. For assessing pneumonia, we have different types of methods and tests which we can do. like blood test, chest x-ray, pulse oximeter, sputum test, CT scan, pleural fluid culture. Firstly, in blood test, this test help us in the identification of infection and the type of organism. But in chest x-ray, it don't tell us about the germ which is causing the infection. In pneumonia, there is a usually fluctuation of oxygen, so we should keep a check on our oxygen level. For this purpose, we should have a pulse oximeter. In a sputum test, a sample of fluid from our lungs is taken after a deep cough and analyzed to help pinpoint the cause of infection. Now, in pleural fluid culture, a fluid sample is taken by putting a needle between your ribs from pleural area and analyzed to help determine the type of infection. By these methods, by these tests, we can easily assess our pneumonia either through CT scan or either different tests which I have mentioned. As my patient is suffering from community acquired pneumonia, so I will give him combination therapy of beta-lactam and macrolide. For beta-lactam, I have chosen amoxicillin, and for macrolide, I have chosen azithromycin. In mild to moderate condition, amoxicillin is given in 500 mg or 200 mg for 10 to 14 days, and azithromycin is given 500 mg for at least 5 days as a part of combination therapy. In severe condition, amoxicillin is given 875 mg or 500 mg again for 10 to 14 days, and here azithromycin is given 500 mg but through IV route. We have broadly, there are three treatment strategies. Number one is if we give antibiotics to all patients with suspected streptococcal infection and do not investigate unless symptoms persist. The second one is give antibiotics to all the patients with suspected streptococcal infection but stop them if a throat swab is negative. And the third one is wait for throat swab culture results before starting antibiotics. As my patient was suffering from fever also, so I will suggest him to take aspirin or ibuprofen or paracetamol. And he was suffering from sore throat also, so I will suggest him to do aspirin gargles. And in preventive measures, I will suggest him to take enough and good sleep. If he is a smoker, I will suggest him to quit smoking, and I will suggest him to take healthy diet and do exercise regularly. And I am attaching my references from where I have taken all these material, so it will helpful for you all also. Thank you so much. Allah Hafiz.